My name is Michelle Gorenstein. I am a clinical psychologist and director of outreach for the Seaver Autism Center. Today, I'm going to be talking a little bit about the evaluation process for individuals with autism spectrum disorders. I thought it'd be helpful to kind of go through two of the common questions that I often get asked by parents. The first question is, what type of evaluation does my child or adult need? So I thought it would be helpful to kind of briefly describe some of the different types of evaluations. The first type of evaluation is a diagnostic evaluation. At our center, a diagnostic assessment is done utilizing the ADOS, which is a gold standard measure used to make an autism diagnosis. You can learn more about the ADOS in the module titled Autism Spectrum Disorders and Gold Standard Assessments. We do the ADOS along with a clinical history focused on early childhood to determine whether or not an individual meets criteria for autism spectrum disorders. At our center, diagnostic evaluation is typically conducted by a psychologist. However, a developmental pediatrician, psychiatrist, or neurologist can also make an autism diagnosis. Another type of evaluation is a neurological evaluation. A neurological evaluation is conducted by a neurologist, and that focuses mainly on the nervous system, sensory system, motor system. A psychiatric evaluation is conducted by a psychiatrist and focuses on one's medical history and behavioral symptoms. A psychological assessment is typically done by a psychologist and uses standardized assessments to measure one's cognitive ability and daily living skills, also referred to as adaptive behavior. There are many forms of cognitive assessments. The two most common are the Wechsler scales and the Stanford-Binet. There are also some measures that we can use for individuals who are nonverbal, such as the C-Tony. There are other developmental assessments, such as the Mullen or Bailey, that we use when testing really young children or individuals who are not able to complete more challenging tasks. A psychoeducational evaluation consists of all the components of a psychological evaluation, such as the cognitive assessment and the daily living skills assessment. But in addition, there's also achievement testing. Achievement testing is testing to look at one's academic levels in terms of reading, writing, and math. And a psychoeducational assessment is often very helpful when making recommendations about an individual's learning style and specific school recs. The most comprehensive assessment is a neuropsychological assessment. A neuropsychological assessment is also done by a psychologist. It includes all of the components of a psychoeducational assessment with additional testing looking at specific cognitive domains, such as attention, memory, learning style, processing speed, and executive functioning. Unfortunately, at this time, there are no specific measures that we can use to do a neuropsychological evaluation for individuals who are nonverbal. One question that I often get asked is, do I need a neuropsychological evaluation to diagnose autism? And the answer is no. A neuropsychological evaluation does give us additional information about how an individual processes and learns information, but it is not necessary to have that level of testing to get an accurate diagnosis. The second question I often get asked is, what type of evaluation does an individual need? Unfortunately, that answer varies depending on the age of the individual as well as the type of service they are seeking. Under the Individuals with Disabilities Act, individuals birth to 3 are able to receive a free evaluation to determine if they are eligible for early intervention services. If a family or parent is concerned about a child's development, they can contact their state's early childhood system directly. They do not need a referral from a pediatrician or another physician. That evaluation will consist of a thorough interview with the parent, as well as an assessment of the individual's developmental abilities, language abilities, and motor skills. If a child is between 2.5 and 4.5 years old and the family or pediatrician is concerned, they can contact the child's school district to get an evaluation. The same is true for individuals 5 through 21. Those evaluations will typically consist of a thorough interview with the parents, a medical evaluation, a cognitive evaluation, a school observation if applicable, and then further testing in an area of concern. So that might be testing by a speech therapist to look at expressive and receptive language, an occupational therapist to look at fine motor skills, or a physical therapist to look at gross motor skills. Individuals will need a thorough and up-to-date evaluation to access services through the school system. However, individuals will also need up-to-date evaluations to access state and federal services. The eligibility for these services is dependent on showing that an individual has a developmental disability prior to a specific age that negatively impacts one's daily living skills. At this point in time, the eligibility requirements do vary state by state. For example, the age requirement can vary depending on what state one lives in. However, typically, what those evaluations are going to consist of is a thorough developmental history, typically referred to as a psychosocial evaluation, and a psychological evaluation, looking at one's cognitive ability and daily living skills. Some states, such as New York, are now requiring a formal autism assessment, such as the ADOS, when applying for services under an autism spectrum diagnosis. I hope I answered some of your questions about the evaluation process. Please feel free to watch other modules to learn more about other issues associated with autism spectrum disorders.